Well, our next guest says there are 3 things you should do immediately if someone close to you tests positive for the coronavirus. So we welcome back cardiologist and researcher Dr. Ernst von Schwarz is with us. You know, this is something really scary, doctor, because it sends people into a panic. I can only imagine. I haven't had this situation yet, but it would be one of those that it's like, oh my goodness, what do I do next? Do I lock myself in a room? Where do you go from here?
Thanks, Kara, for having me on. Absolutely. There's a lot of fear, a lot of this knowledge out there, of course, what we should do. So first of all, if you think you have the virus, you probably do have the virus. So if you think you are sick, the first thing you have to do is stay home, quarantine yourself. The second thing is get tested. That's the only way to find out, basically. And the third thing, of course, is inform your closest contacts about the potential exposure, especially if you test positive.
Okay, so those 3 simple things. When you say stay home, quarantine yourself, how long are we looking at right now?
Well, it depends. If you are tested positive, then the recommendation is, of course, to be isolated, meaning you should stay in a room. You should use your own dishes, your own towels, ideally your own bedroom, your own bathroom, at the minimum for 10 days. Or 3 days after there's no more fever, without fever-reducing medications. That depends, of course, a little bit on the severity. If you are not sure and if you are exposed, then the recommendation is to quarantine, meaning avoid going out. You don't need to isolate that strict, but you should be quarantined for a minimum of 14 days, 2 weeks, basically.
What if one of your loved ones or someone who you've been with does just get tested, does not have the results back? Would you suggest the same sort of rules as far as also quarantine yourself until they hear about whether or not they've tested positive?
Well, it depends to whom you're asking. So basically, there is no mandate that everybody needs to be tested. On the other hand, we as physicians, we strongly recommend if you have exposure, get tested. Keep in mind, the virus is contagious before symptoms occur. So the incubation period is probably 7 to 14 days, but before someone gets sick, even 2 to 3 days before, it can spread and can infect others. And even during the illness phase, depending on the severity, for 10, sometimes 20 days, that person still can be contagious. So if you have close contact, absolutely get tested.
How easy is it to get a test?
Well, most cities and states and counties have the free testing centers, which provide usually the nasal swab, which is a PCR, which detects the virus, RNA, an antigen test, basically, that takes a few days to get the results. That's relatively easy. Some places offer what is called the rapid PCR test, where you get a result within 1 or 2 hours. There's actually a national shortage on that right now. And there's the antibody test, which has no sense really in the acute phase. But afterwards, if someone thought he or she had been exposed or had been sick, it makes sense to do an antibody test, a blood test, to see if the person actually was exposed and was sick and has developed antibodies.
How reliable are all of these tests?
Well, the nasal swab is very reliable. According to the data, it has a 90 to 95% reliability. The rapid test is a little lower than that. It's mentioned 80 to 85%, and the blood test is in the same range.
What about that antibody test?
Yeah, that's a blood test.
Okay.
Yeah, they're very reliable. Keep in mind that a negative test really does not always rule out the exposure. In some cases, especially if there's continuous symptoms, we recommend a repeat testing. And for us as healthcare providers, even if we tested positive and feel sick, feel healthy again, then we do require 2 repeated tests within 24 hours apart, which have to be negative, before we allow our healthcare workers going back to the hospitals or the clinics.
Now, I know I've been guilty as far as symptoms go and saying, okay, is this a symptom of coronavirus? Whenever anything little spikes out of anyone that I know, are there certain symptoms for you that are no-brainers, like immediately go in and get that test?
Well, fever is the number one thing. So you have to check your temperature at least twice a day. Breathing issues, severe cough, chest pain, confusion, loss of consciousness, these would be very severe symptoms. You have heard in the news that some people just report loss of smell or loss of taste. That can be a symptom. Actually, that symptom can last for several months, even after the disease has basically completely disappeared. So it's a variety. Nothing is, however, specific. So it's more or less the same symptoms which you might have if you contract the normal flu.
Okay, so get in, get tested, and then keep yourself quarantined there. What other great tips do you have for people who are kind of in a panic about getting this virus?
Well, I mean, social distancing is key. Wearing a mask is key. Repeated hand washing, disinfecting of surfaces which are frequently touched is absolute key. So I strongly suggest avoid the gatherings. Most of the cases we are seeing now are actually people who got the virus from family gatherings where one person was sick, maybe even without significant symptoms, and then they bring it home into their household. So stay away from the gatherings, wear masks, and keep a social distance.